So UWorld is the most important resource for Step 2 CK, and it is actually the core resource for this exam. And unlike Step 1, which also focus on UWorld, but for Step 2 CK, there are not a lot of resources available for preparing for the exam. So UWorld is deemed as the most important one. So it is important to get the most out of the concepts from here as well. So this is what I did for UWorld. For the first pass of my UWorld is where I got most of the concepts and made my own notes. I would say I made my own notes because I have my own note taking system, and I know there is UWorld notes as available, but I think I have my own note taking system. It was more effective for me, so it is better for me to make my own notes. UWorld is comprised of the questions, answers, and images, as you all know, because I know you've taken this for step 1 as well, and it's about the same for step 2 CK, which is the vignette, the cases, or the answer questions, or the case questions, and then the answer choices, which is A to, I don't know how much choices they want to throw into you, and then images. If there are images, it's not for every question, but if there are images, this includes like derm images, and then echo, X-ray, CT, MRI, and NST usually for OB, and then PBS for hema onc questions, and then very rarely, or I can't remember if there was any histopath. So I think histopath is more for step 1 than step 2. And then third is the questions, and then when you answer the questions, it will give you the discussion part regarding that question or related to that question. So for the discussion, I would divide the discussion into 3 parts, which are the main discussion. Number 1 is the main discussion. Next is the rationale for incorrects, or rationale for each choices. And the third one is the educational objective. So for the first pass and when making notes, I would focus on the main discussion, which is the main discussion related to the case and the question, and then the rationale for each choices. So I would break this down, and this is what I noticed for most of the questions in UWorld and Step 2 CK in general, that the most important things to know, and of course this is not for all questions, but most of the questions, except for the general knowledge questions and the biostat questions, the most important things to know and the most common asked questions are the following. Number 1 is, what is the diagnosis? For this one, to be able to recognize the pertinent findings or clinical features of the disease is so important. I would say for these are the kind of questions that are very straightforward, and there are quite a few questions that are very straightforward as this in the real deal. Number 2 is, what is the cause of the disease? For this one, it's asking about the etiology of the disease. So this is usual for infectious diseases questions. Mostly infectious disease, like what is the cause, or what is the causative pathogen for this disease. That is very common for those ideas. For this recent changes in the step, I would say there are lots of military questions, not lots as the risk factor question ones, but there are military questions which focus on this, because military questions mostly focus on infectious diseases, and I encountered some in my blocks as well. Third is what are the risk factors for this disease? I didn't realize the importance of knowing the risk factors, and focusing on the risk factors until later in my studying. And since the November changes, I've been reading the People Notice a lot of factor questions, and the Divine Intervention podcast is really hammering on this. And yes, this is also true. In my exam, I got maybe 2 or 3 per block of risk factors in the real one. And I know there can be a lot of risk factors for certain disease, and sometimes the answer is not just the most common risk factors. Like, for example, smoking is the most common risk factor for coronary artery disease, but the patient has less than 10 years of smoking history and stopped like 20 years ago. Then that is not the risk factor to look for anymore. So most likely there are other risk factors that are pertinent to the case. So I guess for this, it is important to know the common, not just the most common or the single most common one, but the common risk factors for each disease entity. OB has a lot of risk factor questions as well, and I think most of the risk factors that I encountered are related to it's either cardio, OA, osteoarthritis, or OB questions. So this is very important, especially in the recent changes for step 2. And fourth would be, what is the pathophysiology of the disease? Yeah, this might be step 1 sounding, but I encountered questions like this in my exam. I think I got like two questions for pathy for my exam, and I realized the importance of this after taking the USA 2 or the UWorld self-assessment 2. Sometimes they would just ask what is the diagnosis, or you have to figure out what is the diagnosis, and then give you the pathophysiology as answer choices. So I think knowing this would be very helpful as well. And the fifth one is, what is the best next step in management? So now this one is comprised of diagnostics and treatment. So it's not just, a single treatment or drug for this. There are many great algorithms in UWorld, and knowing those algorithms and taking note of those, especially in trauma cases, helps a lot. These algorithms are just the main ones I use for trauma cases, because algorithms differ for different resources. For me, I think UWorld is enough for this part. And I think for the best next step in management, for example, for the drugs, it is good to know the MOA for each drug, and of course the most common adverse effect for this drug. But I encountered a few farm questions like that in the real one, but it's not usually, they wouldn't usually ask for that, because that is more on step 1 than step 2, but it's good to know those for moral support. So this is for the main discussion, and I would try to get the most out of it for the case discussion. And sometimes UWorld would give this table summary at the first part of the discussion, which is great, and I use this a lot because it's good for crunch time, but still for the first pass, and when you're getting, doing this for notes and all, I would say it's better to still read the whole case discussion. The next part is the rationale for the choices. So there are below the discussion part is the rationale why each choice is wrong. So I realized while I was studying that the type of answer choices, for the most part, again, not for all, I don't think you will encounter this in the general knowledge questions or the biostat questions, but the type of answer choices in UWorld or Step 2 CK questions would give you choices specific for a different disease entity. Let me give an example for this. So, for example, the vignette is about pulmonary embolism, PE. So the clinical features would be about PE. The question would be, what is the best next step for management, and then UWorld would give you choices like a contrast esophagography, which you will do for esophageal rupture, and so this is technically wrong. And then B is give beta blockers, which would be a management for aortic dissection. And then C would be give anticoagulants for, which is the management for pulmonary embolism for high probability pulmonary embolism without any contraindications for ACs. And then D would be give NSAIDs and colchicine, which is for acute pericarditis. As you can notice in this answer choices, this are the differentials for PE, because PE, you'll have pleuritic chest pain or chest pain, and then as you know, step 2 CK, its question is not very straightforward. Like, what is the management for PE? It's not that question. They wouldn't tell you it's PE. You have to figure out the pertinent findings for it. So the question would not tell you, yeah, this is PE, and then what is the management for PE? No, it will give you the pertinent findings seen in PE, and then you diagnose it with PE, and then answer the management of PE. And this part is great for knowing the most common differentials for the certain disease entity and be able to group it and be able to know the differentials, because this is the usual answer choices and type of answer choices in the real deal. Although there are some weird answer choices, but for the most part, this would be the answer choices for it. So I think to be able to diagnose it at once and be able to know the differentials of it would be very important. And for example, it would give you a URL on why it is not aortic dissection, and it will have a brief discussion about that, why it's not aortic dissection. So it's good to take note of that. So I mainly use this part to know the differentials and list them in my notes, so I would not make the mistake of making the wrong diagnosis and, well, a wrong management after all. I would just breeze into this part at first, so I just breeze into this because I didn't fully understand the importance of this part. But eventually, when doing the random time questions, I was so confused on the differentials and how to diagnose the cases. So I realized knowing how to differentiate it and knowing the differentials through looking at this different answer choices and the rationale for them is very important. As I've said, this is true for most of the questions in UWorld, because UWorld or Step 2 mainly focuses on certain disease entities, but it's not very helpful or very specific for general knowledge questions and biostat questions. Approach would be different for this kinds of questions in the note taking part of this. But for the most part, I think understanding this helped me a lot in making my notes and approaching UWorld. Last part at the bottom would be the educational objectives, basically the summary of what is above and what was the case discussion all about. And I would still read this, but this is more helpful in the crunch time, like weeks before the exam. For my incorrect, I would go through the whole part of main discussions and rational for choices, then go back to my notes. But for the correct ones, in the last few weeks, I would just go over the educational objective, just so I know that I have a similar thinking and approach in the questions I got right, and I was not just guessing on it. So next is the timeline in making notes and approaching your UWorld. At first, I was so overwhelmed because of the number of questions. Like there were about 3,800 questions in UWorld, and how there is no specific structures for it. So it is not like first aid in step 1 or FA, where it was broken down into systems and subjects for me. So I was so overwhelmed of how scattered the concepts of UWorld are, and it would be just based on the questions you get from the blocks, and my notes are everywhere. So what I did for the first pass was structuring and solely focusing on structuring my notes. I made my own notes, and during my first pass, I did this system wise blocks timed, and I would make notes from there. So, for example, for cardio, I would give like 3 to 5 days for cardio, and solely for cardio, and doing all the blocks, or not all, but most of the blocks regarding cardio in UWorld. And then for the next 3 to 5 days, I will go on to the next system. And then I think I gave like 1 week for OB-GYN, and I think another week for just all psych questions. And then I think a few days for biostat and ethics questions. So I did this for all the systems and for every subject. And then I did this for the first pass system wise timed mode, and the topics are still scattered though. So as I go through it, I would group these cases per topics. Like for example, in a certain block you would get questions about valvular dysfunctions, then questions about endocarditis, and then other questions about arrhythmia. And I think it's still scattered. So what I will do is I will group these diseases based on the area or topic, like all arrhythmia. And then when I encounter an arrhythmia question, I would put I would place this in this area, something like that. And after doing this, at some point, after doing the system wise one, I switched to random time questions. I think after about 50% being done with the 3,000 plus questions, I switched to the random time questions. But I was still taking notes based on this. I have the structured notes already, and then I would just add these topics that I encountered in the random time questions and put it in my notes. I did do a reset after the first pass, after all the questions, and then I did the second pass, which is entirely random timed questions. And here is when I made edits and changes, or well, additional notes for my note taking system. And I did my incorrects after this one. And then during the last weeks before my exam, I would mainly reference in the notes I have from UWorld.